Could you help us understand the different types of hair loss, ma'am, like androgenetic alopecia, telogen effluvium, and alopecia areata?
So, for the patient, it's just going to be hair falling out of your head. But when it comes to going for treatments, it's very important to identify what exact cause is there behind your hair fall. So, the most common type of hair fall is androgenetic alopecia. Even some women experience it. It's where your genetics and your hormone come into play. So androgen means hormone, so your testosterone. Even women have it in a lesser quantity, but when they go through PCOD or thyroid issues, their testosterone goes up, and then it causes alopecia. And then there's a genetic influence playing into it. So this is androgenetic alopecia. Telogen effluvium is where, like I mentioned earlier, when your body goes through a certain stress and then recovers from it, your body prioritizes the important organs. So your hair and skin are kind of least prioritized, and then it starts to get, less prioritized. So it starts to fall, your skin starts to get dull, and all of that happens. And alopecia areata is something actually completely different from everything else we spoke so far. It's actually something I would say as autoimmune disorder. So I would like to compare it to a dust falling inside your eyes. Like say for example, there's a dust falling into your eyes starts to water up and it tries to eject the dust. So it's basically your body rejecting a foreign object. So what happens in autoimmune disorder is that your body thinks your own body is a foreign object and it tries to reject it. Same thing. So when your body focuses on a particular location, say for example the back of your head, or for some people it is a beard, that particular area, all the hair follicles get rejected. So you start having patches of bald spots on your skin, and those patches will be very shiny. Some doctors they mispredict it and they end up doing hair transplant on it. So it's not the hair's fault, it is that particular location's fault. So when you're doing hair transplant on this, you're going to lose that hair as well. So you focus on suppressing the immune response in that particular area. So the treatment kind of changes for the three different hair loss types that we mentioned right now.
So speaking of alopecia areata, some people try home remedies like onion juice, right? Does that actually work?
Your onion has nothing to do with suppressing your immune response, so it is not going to come back. Worse than that, I've seen people cut that particular portion with blade and then rub onion into it. It is not going to come back. Some people, when their areata patches are small, after a certain period, like mostly, you don't exactly know why androgenetic alopecia happens. It can happen because of anything. For some people, it is because of stress. Like when you stress out, you see these patches in the beard. But then when your lifestyle becomes better, you've started to handle your stress, this patches for some people goes back to normal. Then they will think like it was because of their onion, or it is because of their, cutting their skin. So they don't directly influence the treatment. For treatment of areata, you'll have to meet your doctors. Corticosteroids help suppress your immune response. So actually, to be honest, everything affects hair, because hair, if you look at the anatomy, it is very loosely attached to your skin. Just suddenly losing weight, you lose a lot of hair. Like I've seen people losing 10 kg, 12 kg in 2-3 months. You'll notice they lose a lot of hair because your hair is attached to your skin by fat, and you burn that fat, the hair falls off. So that is one. And it can be your food. So protein, when your protein is less, you're going to lose hair. When your nourishment, your nutrition, your micronutrients are less, like I mentioned, your iron, your zinc, your vitamin D, your magnesium, all of this is very important for the way your hair is growing. So when your nourishment is less or it's not balanced, you're going to lose hair. Sleep is a very, very important factor. I mean, I've read an article where if you don't have that 11 to 6, that sleep, your brain actually doesn't produce a hormone called melatonin. So that's a gland on your brain called pineal gland. This gland produces a hormone called melatonin, which is actually very good for your hair. That is why you notice all these people doing night shift jobs, they lose a lot of hair because this particular hormone is not produced properly. But now, everything is commercialized, like people started selling melatonin, but it's not as good as the one that is naturally produced in your head. So sleep is very important. Stress, obviously, cortisol is produced when you stress, your flight, fright, and fight hormone. So this can cause hair fall and breakouts also. And hygiene, this heat. You wear helmets, you don't protect it with the cloth inside, you sweat inside your helmet, you wear it, sweat comes back on your scalp. So hygiene is damaged, dandruff comes up, you share combs with everyone, you're staying in a PG, you're sharing comb, you're sharing your pillowcase, it is going to keep transferring, and not using the right products. Some people are, they use hair gels, they use this heating products, it can damage your hair and skin. So literally everything can cause damage to your hair, because hair doesn't fall because of this one particular reason. It is because of this is multifactorial reasons why you actually lose hair. So when you're taking care of it, you'll have to take care of it as a whole.